Doctor, one of the things that we talk about and see, especially in this part of the country, is Lyme disease. Can you explain exactly what that is? It's a tick-borne illness, but what's going on once somebody has a tick and gets that disease? What's going on with them, and can you explain what that is?
Yeah, so it is a specific tick, the deer tick, which is usually hard to actually see. Full-grown deer tick is about the size of a sesame seed, but it can occur even at their younger stages, which is very small. So it's not the typical wood tick that patients see. But the tick usually has to be embedded in the skin for over 24 hours in order to cause an infection. But it's usually the infection is sometimes hard to actually realize what symptoms they have going on, because it can act really like a viral type of an illness: fever, muscle aches, fatigue. They may get a target rash, looks like a bullseye, but that typically only occurs maybe 20–30% of the time. So it makes it hard to diagnose.
So what's a patient feel? And how long does it take to get these symptoms, and is that one of the reasons why it's hard to diagnose?
That is one of the reasons why. It's that the symptoms usually can be such of a slow onset, but that they tend to be ongoing. So the ones that when we're aware of it, they say, I was bitten by a tick, usually it's going to be treatment with antibiotics for a 10-day course. And for the majority of symptoms, they'll resolve with the treatment with antibiotics. But it's those certain patients that for some reason, they don't tend to clear the infection, either because they never sought treatment and they have ongoing illness such as the fatigue, the muscle aches, joint pains, which as that encompasses their entire life, it can affect their how they work, how they go to school, their functioning, their brain function, and it just really can be debilitating for them.
So we've seen hyperbaric oxygen treatment be successful for conditions like that. Why is that, and what is it doing to either mitigate the symptoms, or, like you said, it's an infection as well, and can it help with that?
Well, more so from mitigating the symptoms as far as the inflammation that can occur. So the anti-inflammatory effects that we see with hyperbarics can really minimize their fatigue, their brain fog, their joint pains, muscle aches.
And can it get rid of Lyme disease, or are there other things that a patient needs to do in conjunction with hyperbarics?
There are usually other things that patients will do in conjunction as well to get rid of the entire infection.
And that can be what, prescriptions, or what can people do to be rid of this condition?
Ideally, it's when they've been treated with the antibiotics.